Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. Today's session is Understanding Healthwatch Rochdale and how you can get involved. And our host is Naomi. Over to you, Naomi.
Hey, good morning. Thank you. It's nice to see you all. So I'm just going to share my screen if that's okay. There we go. So good morning, everyone. My name is Naomi Kenyon. I'm the Engagement and Volunteer Manager at Healthwatch Rochdale. So a little bit of background about Healthwatch. The Healthwatch in general was set up in 2013 as a result of the Health and Social Care Act in 2012. We are part of the Healthwatch network. There's not just us in Rochdale, there's 151 of us across England, and we're supported hierarchically by Healthwatch England. Overall, we build a national picture of what matters most to users of health and social care, and we mainly do that by gathering feedback in around health and social care. The evidence that comes in through that feedback is used to influence those who plan and run services at a national level. So just a little bit about Healthwatch Rochdale, which is us. So we run over the 5 boroughs of Rochdale. So we're the independent voice for residents of the Rochdale Borough within Greater Manchester. We listen to experiences of local health and social care. We feed back to service providers, and we also give a stronger say in local services. The role of Healthwatch Rochdale. So our role is for a better health and social care experience for everyone in Rochdale, our vision, sorry. Our mission is that we are the independent voice of local people in challenging and influencing health and social care provision in the Rochdale Borough. And we have our values. So our values are that we're independent, we're credible, we're collaborative, inclusive and responsive. So our objectives, we have our strategic objectives. So we remove barriers so that choices can be made by all residents about their own and their families' health and social care needs. We work with others to achieve the best outcomes for the provision of health and social care locally. And we deliver innovative ways of working, new opportunities, positive outcomes, and also value for money. One of the ways in which we share the word and spread the word about what we do is we have a wide range of social media channels. We're on Facebook, we're on Instagram, we're on Twitter, we're on LinkedIn. We also have a YouTube channel. You can telephone us. We do have newsletters what go out. We have monthly newsletters as well as quarterly newsletters. And we have just released our spring newsletter, which you can download on our website. Or we can actually give you, for the first time in 2 years, we've got a hard physical copy of our newsletter available now. Across them different channels and within that different literature, we share about the work that we do, the things that we've got on, also opportunities that we've got for volunteering. And you can subscribe to these as well. If you go onto our website, you can sign up to receive alerts and also receive PDF attachments of any newsletters. So how we gather feedback, one of the main things that we do at Healthwatch Rochdale is we gather in feedback. It's one of the biggest things that we do about health and social care. And we rely on a wide range of opportunities to gather that feedback in. We have our website, we have a share your views section where you can just click on it, and it's a web form where you can easily input your feedback around a local service. We do use Care Opinion, which is a bit like TripAdvisor for health and social care, which is online, it's a website. We do attend as well focus groups and forums. If we're trying to gather feedback on a very specific topic or on something what we've been asked to, then we will set up focus groups and forums to do that. We attend local networks. We're part of a lot of networks locally, including quite a few with Action Together. So we do go to them and we use them as well to spread the word of Healthwatch, but as well as gather feedback by our volunteers. We have information, advice and signposting sessions, which we hold locally across the 5 boroughs. We hold a session it's generally the Tuesdays of every month. We're in different areas and with from 10 till 12 at most of them. So we do give out information, we give out advice, and we can signpost people to other services within the Rochdale Borough, as well as listening to feedback. We do quite a few surveys as well as questionnaires. We do attend local groups and organisations, if they hear something in them groups, they share that feedback with us, or they signpost people within them groups to us to share that feedback with us. And social media. During the pandemic, A lot of our work all went digital, as did everybody's. So social media really did become a big part of how we gathered feedback around services locally. And one of our newer things that we've got, we do have a QR code, which I couldn't find the image for, but we do have a new QR code what people can just scan in and send feedback to us. But also we have got a text number, just because a lot more people are using the mobile phones and things. It might be a lot easier if people are sat in a doctor's waiting room or something, and they can just text us their feedback immediately on that number around their experience. So we have many statutory roles, and how we carry them out is mainly with the help of our volunteers. And we have a board of trustees who are all volunteers. We have an advisory group, again, volunteers. We have some Youthwatch members who are volunteers. And we do, before the pandemic, we did something called an interim view, which we have the statutory duty powers to go into care homes. And we go into these care homes and we look at what's going on in them, speak to the residents, speak to the staff, speak to family members, and we then can make recommendations from them visits. Unfortunately, with the pandemic, that's not been able to be done. So hopefully we will be able to pick that back up again at a later time. We host a maternity voices partnership. We do a lot of signposting. Again, our volunteers are massive key to this. And now that things are letting us, we can do stall holding again at places. So one of the main things, as I said, that we do is the volunteers are absolutely vital to our organisation. You know, it's really important that we have our volunteers to help us do the work that we do. We're a very small staff team, but we do currently have 18 volunteers. So there's a number of reasons why you can volunteer, and it's really important for people to volunteer. It builds your self-confidence, you can build your CV up, you can also build your own skills, you can do training, you can meet new people, insights into the work that we do and things locally. As I said before, the volunteers are a vital role to our organisation. Links with the community. If you've got good links within your community, volunteering is ideal because you can share the feedback with them, gather their views and share information back to your communities, massively to make a difference. And the feedback that we gather in makes a difference locally. So by being a volunteer, you're helping gather that feedback in and helping make that difference. You can build up hours as well as part of work experience, and a better understanding of health and social care in the Rochdale Borough. Over the COVID pandemic, a lot of people haven't been able to get work experience to build up skills for university and things like that. So by volunteering in general, you can build up them hours, and it's really good for when you're doing your CVs or your personal statements for higher education. And we can do things like micro volunteering. So all the roles that we have, we can condense them into shorter ones to help build those skills. So one of the things that we do as well is, now that we've been able to, we can gather our volunteers together again. It was absolutely lovely last year. This was a thank you event which should have been part of Volunteers Week in June, but because of the pandemic, we couldn't meet face to face. So at the first opportunity in September, when we could get people together, that's exactly what we did. We got people together. So what we did is we had an afternoon tea at the Flying Horse in Rochdale. We have quite a few of our volunteers came alongside the mayor, and it was just absolutely lovely. They had goodie bags and little thank you cards and things like that, and it was just so nice to see everybody after such a long time and not being able to see people face to face. And also, since then we've had a couple of other coffee gatherings. We have been meeting on Zoom as well and catching up with each other. Also, some of our volunteers help us with social media campaigns. In the picture in the middle there, that's Mel, one of our board members, and we were doing a raising awareness of having the COVID vaccination. So Mel was our poster girl for this, and it's coming up to Volunteers Week in June as well. So if you subscribe to our social media channels and our newsletter and things, there will be more information, especially during Volunteers Week, on the different opportunities that we have as volunteers. We do have an admin volunteer, Elizabeth, and she's been with us over 6 years now. So she's our longest standing volunteer, and we're very proud of the work Elizabeth's done. And even in the pandemic, she worked from home for us doing admin tasks and things. So the roles can be adapted. Between December and February, December last year and February this year, our volunteers gave 84 hours to our organisation, which is really, really good, between meetings, gathering feedback and stuff like that, as well as training that they went on. So we got 84 hours, and like I said before, we do currently have 18 volunteers with us. One of our volunteering opportunities is our advisory group. Now, our advisory group are made up of, at the moment, we've got 6 members, and we have a chair, Karen Kelland. We always need new members for our advisory group, and we're always on the lookout for new members. They meet monthly via Zoom at the moment, just because it's the easiest way to meet with everybody living in different areas and other time commitments and things. And the role of the advisory group is to ensure that the views and experiences of Rochdale citizens in relation to health and social care are coordinated and communicated to our board, of trustees are at the top. It's to inform and support the decision-making process, ensuring that decisions made are focused on local need. With our advisory group, when they meet, they get a report every month of all the feedback that I've gathered in. It's narrowed down into categories and things, as well as we use local care opinion information as well and feedback. And they do use this to talk about issues, look at what's going on locally, and see if there's specific trends in feedback as well. So with our advisory group, over the last couple of months, there has been key things what has come up. Access to dentistry has been massive, not just for us as Healthwatch Rochdale, but nationally across all the health watches. Access to dentistry and access to GPs is a massive part of the feedback that we're getting in at the moment. We did have a lot of inquiries around support for adults with autism within the Rochdale Borough, what the pharmacy offer was, because things have changed now within pharmacies, mainly again through the COVID pandemic. Hospital discharges, GP cross-boundary issues, ear care services locally, menopause support, what there is locally. When we first got inquiries around this and we inquired out, there was very little support within the Rochdale Borough for menopause. And as these last couple of months have gone on, we're now finding that there is a lot more coming out around the borough, especially like in Fairlinch Park. They've got a little hub there with the vintage works who do a weekly session. So there is things going on. So sometimes it's about inquiring, but then things do pop up in the Rochdale Borough quite a lot. Another thing that we did was a moving on service report. We got a lot of feedback in around a service that had shut in Middleton, and that the service users weren't happy about this, as well as residents weren't happy about this. So we did raise this issue, and we did a full report on this, which you can see on our website. Our other volunteering opportunity that we have is Youthwatch Rochdale. Youthwatch is a really, really key part of Healthwatch. We realised that we didn't gather as much feedback locally from young people, and so we looked at how we can gather feedback in from young people around health and social care, because issues for young people are very different to issues for us. Dentistry for us could be that we're getting false teeth, or that we need a scale and polish, but for young people it's more around like the orthodontics, where there's very long waiting lists for braces and things, as well as referrals. So it's a very different set of feedback that would come in around different topics. So Youthwatch is for young people aged between 13 and 18 years old, and they either live, work, study, or access services within the Rochdale Borough. And we want them to be a volunteer with us, because again, like we were saying before, it can build up their CV. It can look good on personal statements later on, and just gives them experiences and skills. So it's to volunteer with us to gather feedback from friends, family, schools, colleges, and the community on health and social care. But also we do monthly meetings online via Zoom. So on the monthly meetings, we have guest speakers. The young people ask for the guest speakers, or it comes in from other feedback or trends that we're looking at for young people. We've had some guest speakers on who've told us about COVID vaccinations for young people. We've had the Rochdale Young Carers Hub give information. This month, which was yesterday, we had a careers advisor on telling the young people about all the different options that are available to them. And we've also had Rochdale Borough Council on looking at the No Place for Hate campaign locally. So the young people have took these things back as well to their schools or educational establishments. The Zoom meetings are the second Tuesday of every month online, and they're just for an hour. And we normally have the guest speaker, and we just have a bit of an informal chat and discussion and talk about any feedback that they've received. And the aim of Youthwatch is to engage the youth of Harewood, Middleton, Rochdale North, Rochdale South and Pennines on health social care matters, giving them a greater voice and inclusion, because it's massively important that young people are heard. You can sign up to be a Youthwatch volunteer on our website, but also you can sign up for our next bit, which is, well, this is the other part, it might be a bit further on, is our Youthwatch 100. So the Youthwatch 100, again, it's massively around ensuring that youth voice is heard. So you can sign up to this so that you receive the surveys through your email every single month, or if you check on our social media channels and things, then it tells you when it's gone live and you can access the survey through that. One of the ways that we wanted to gather more youth voices with the Youthwatch 100, the idea is that 100 young people sign up to it. Every month they get sent either a survey or a questionnaire or a leaflet or something to review. They fill it in, send it back to us, and they get put into a draw at the end of every month, and they could win an opportunity to win a £20 voucher. And the £20 voucher is a voucher of their choice. So January's topic was the COVID vaccinations and flu vaccinations. February's topic were around hate crime and racial inequalities. March, we had a little bit of a break because we did some online feedback and things. And then this month's survey is all around the use of social media, young people's use of social media, and our Healthwatch's social medias for them to have a look at and review, because we want to ensure that it's accessible to all, and it's the young people especially are taking an interest in our social medias. So again, people can sign up to the Youthwatch 100. Again, it's for young people ages 13 to 18 if you live, work, study or access services in the Rochdale Borough. And some of the surveys as well are used in general with the feedback what comes in. It is looked at anonymously as well. So the young people don't have to worry that we'll be telling other people such body said this. So it is all anonymous what comes in. And it is just an area where you can put your name and email address so that you can go in the draw for the £20 voucher, but your name and email address will not be used on any of the survey information. The other thing that we do is we have the Rochdale and Oldham Maternity Voices Partnership. So the Rochdale and Oldham Maternity Voices Partnership has just celebrated its 1 year with us. So we have a purpose and vision. So the Rochdale and Oldham Maternity Voices Partnership purpose is to champion the voices of women, birthing people and their families in the development of maternity services within Rochdale and Oldham. MVPs exist to ensure the voices of women, partners and families are heard, communicated and responded to. The vision is to improve in experiences of maternity for women, birthing people and their families through multidisciplinary collaboration and massively on co-production. And it brings service users' voice to the centre of planning and strategy. Our Rochdale and Oldham Maternity Voices Partnership is run by our chair, Leona Barlow, and we've just recruited a vice chair as well into the role. Our vice chair is a resident of Oldham and our chair is a resident of Rochdale, so we've got a good balance there between the two. What are they about? So they're about working continuously to improve the quality of maternity care, and as part of that, they have a focus on closing inequality gaps, listening to and seeking out the voice of women, families and carers using maternity services, even when that voice is a whisper. So we're really, really keen on working within the communities and ensuring that we get everybody's voice is heard about their experiences. Again, it's all about gathering feedback on these experiences and enabling people from diverse communities to have a voice. We're currently recruiting for volunteer advocates for this. You can sign up on our website under the Maternity Voices part on it. With the volunteer advocates, with the maternity voices, they're called volunteer advocates, and a lot of their role is around visiting. We call it walking the patch. It's around visiting local children's centres, community centres, anywhere that you might go with your own little ones, and just having general conversations and gathering that feedback in, as well as looking at co-production of things. We work alongside the Oldham Hospital, sometimes midwives and other people send leaflets and posters for us to review to ensure that the wording's correct, the images are attractive or appropriate. So they do a bit of co-production work as well as attending focus groups and meetings with us. Our priority work streams is health inequalities across Rochdale and Oldham. There is still massive health inequalities in maternity services, and that's been massively highlighted by the Ockenden report, as well as the equity and equality strategy what's at the local hospitals. Parent infant mental health, Rochdale, we work very closely with the Rochdale team over there. Breastfeeding is a huge thing as well. One of the good things that we got a lot of feedback in during the pandemic was that breastfeeding had massively increased within the borough, but there is also massive differences between breastfeeding services in Oldham and Rochdale. So we want to make both areas have fantastic breastfeeding services and infant feeding in general. Smoking in pregnancy, there is specific midwives who trying to get people to stop smoking in pregnancy, and they can offer help, advice and patches on that, and we want to massively help work alongside them. Communication to service users. During the pandemic, most maternity things went massively all over social medias. Instagram's really, really big now, and we didn't have an Instagram account. So one of the things that we want to do is raise our profile within Instagram. And our new vice chair, I think, is going to be doing a lot of work on the social medias. Again, gathering feedback. We're always wanting to gather feedback. Walking the patch, which is, like I said before, the volunteer advocates, going out to community-based services and coffee mornings and children and family things, and gathering in that feedback and chatting to people and raising awareness of the MVP. And the Ockenden report. The Ockenden report has just had its second report what's come out, and it's got a lot of things within that are recommendations to do locally, so we will be involved with a lot of things to do with that. Engagement is also a massive part of Healthwatch Rochdale, and this is something that we have so missed over the COVID pandemic. Being out and about, out there in the heart of our community. Rochdale is an amazing place, and it has so many good groups there and so many different things that people can attend. So we're really, really pleased that we can go back out on engagement now. We do have a new engagement project worker called Celeste, who is going to be out and about in the borough. You'll probably see at many different things over the next couple of months. We hold a number of information, advice and signposting sessions in the Rochdale Borough. The next slide has got some more information on them. Over the last 3 months, we have given 93 people information and signposting things for local services. As an organisation, we're really keen to ensure that residents, local groups and organisations are massively aware of the work that we do. It's sometimes we still go places and I'll say, hi, can I speak to you about Healthwatch Rochdale? And people do say to me, who are you? So it's massively around raising that awareness of who we are and what we do in the borough. So we're actually looking at the moment for services, organisations, groups, businesses to invite us along or invite us in. It can be on Zoom or it can be in person, to do an awareness raising session. So a little bit like this, really, telling you what Healthwatch Rochdale do, telling you a little bit more about the volunteering opportunities that we do, or even about a feedback gathering session. So if you have like a women's drop-in group, it'd be brilliant to come along and get, have a feedback session with those ladies. So if anybody would like to have either an awareness raising or feedback session with us, you can email us at info@healthwatchrochdale.org.uk and we can book a session in. So these are some of the things that we've got going on. We have sessions at these specific places every single month. So we're booked in for like the next year as such, hoping that there will be no more lockdowns. So we're at the Lighthouse Project in Middleton, the Strand over at Cacombe, Rochdale Infirmary, Harehill Cafe in Littleborough, the Nye Bevan up near the train station in Rochdale, and the Phoenix Centre in Haywood. So we're doing information, advice and signposting covering all 5 boroughs of Rochdale. But again, we're quite happy to come into an organisation or attend a group session anywhere, and we just come along with information leaflets, some of our booklets. We have some new pens what we give out. Everybody likes a nice pen. So we do have, we can come along and have a chat with you. So if we've got any questions, there. And then finally, please don't hesitate to contact me if you'd like to know more. Around our volunteering, we have got opportunities on the Action Together volunteering database as well, where you can access things and it comes through to us if people have raised an interest in it. We do have a specific area on our website around volunteering. Obviously, as it's volunteering, it is not a paid role. But you can do as little or as much, as you like, depending on what you want. And at the moment, we're looking at developing social media volunteer roles, as well as potentially volunteer readers to look at our reports and things like that, and go through it in finer detail. So we have got a number of roles at the moment which we are in development of as well. But we currently do have active advisory group member roles. We do currently have the Youth Watch roles and also the Rochdale and Oldham Maternity Voices Partnership roles. So at that, I will stop sharing my screen.